Hi, my name is Madeline Capilupo, and my presentation is on sex trafficking. Before going into all the statistics and other information, I wanted to say why I chose this topic. I chose this topic because I think it is really interesting, and I want to work with people who have experienced this kind of trauma and other traumas. I also think it is very important to talk and learn about. And after researching this topic, it was upsetting but very eye opening. For this slide, I wanted to mention the definition of sex trafficking. It's a long definition, but I wanted to point out what I think is important. Sex trafficking is the recruitment of people and forcing them into sexual labor. People that get trafficked is not limited to race, ethnicity, age, or gender, but there are people who are more vulnerable than others. For example, children and adolescents are most vulnerable to be forced into sex trade. In the articles that I read, it mentions that 1 in 5 runaways are at risk and 326,000 youths are at risk for child trafficking. And according to the International Labor Organization, 27 million people are being trafficked annually. Knowing all this information, it's important to see how all this trauma affects a person. In one of the articles that I read, it was mentioned that people who have been trafficked rarely seek counseling independently, and when they do, victims show signs of depression, dissociative reactions, suicidal thoughts, PTSD, feelings of guilt, shame, and self mutilation. It is noted that victims might also have histories of solicitation charges, substance use issues, lack a strong support system, and visible bruising or branding. Branding is a method of identification used by traffickers to indicate ownership with tattoos or carvings. I also wanted to add a quote from Stacy Liddum's client, who is a survivor of sex trafficking. The client said, "Nobody is going to buy someone with track marks." I wanted to add this because this shows how they are being treated and how this is breaking them down mentally. Victims were forced to be injected with opiates in locations on their bodies that would not detract from their price. According to counselors and medical professionals, trafficked victims struggled during a mental status exam, and this was due to combination of working long hours, exhaustion, and frequent transportation. Traffic victims may unfortunately have been exposed to STIs, pregnancy, history of unsafe abortions, chronic pain, malnutrition, substance use issues, and sleep deprivation. Other health impacts include infectious diseases, such as diabetes or cancer, that were either undetected or untreated. Sex trafficked victims are also being in areas that won't damage their appearance, like their lower back. Survivors will struggle after all the trauma they unfortunately experienced, so the type of treatment they receive is important. It is important to provide framework for accommodating the vulnerability of trauma victims. In one of the articles I read about treatment for trafficked victims, it mentioned how mental health therapy is based upon one or more theories of psychological treatment. Behavioral therapy focuses on increasing desired behaviors and decreasing problem behaviors, through environmental manipulation. Cognitive therapy works to change behaviors and feelings by altering how patients comprehend and understand important life experiences. And lastly, psychodynamic therapy explains behavior and personality as being motivated by inner forces like past experiences, inherited instincts, and biological drives. The trauma sex traffic victims go through is sad. Their human rights are being taken away from them, and they are treated with no respect. Victims will most likely suffer from PTSD along with anxiety and mood disorders, including panic attacks, obsessive compulsive disorders, generalized anxiety disorders, and major depressive disorders. And when they go through the stages of treatment, some are able to move on, but others are unfortunately traumatized. But with time and the right treatment methods for them, they will be able to feel safe again. In one of the articles I read, it mentioned that 1 to 2% of child trafficking victims are recovered.